information that will help plan nursing care, provide clients the opportunity to discuss their care, evaluate the nursing care the client has received, and client can participate in nursing rounds. Nurses need to use terms that the client can understand, and medical terminology exclude so that client will easily discuss the topic. Transfer reports. Transfer usually from one unit to another unit. It may be in person or it may be over phone. All pertinent data about patient should be known to other unit, and send all belongings with client and review clothing or belonging list prior to transfer. Before transfer, you have to organize all the things. And transfer sheet documentation. It is very important because what treatment you have given and what should they follow, it is to be clear very much. And another is incident report. Incident report is any event not considered routine, that is patient's fall, little stick injury, medication errors, accidental omissions, visitor's injury. These are called incidental reports. Risk management will analyze the trends of the client, and changes in policy or procedure. Educational programs may be related to findings. And please notify your supervisor, physician about the incident. And nurses who witnesses about the witness, she also makes some report and must also sign the incidental report. Do not assign blame, be objective, and only facts are reported. Another is tele-nursing. It is helplines to assist clients decision making about how and when to use healthcare services. Agencies such as health units, hospitals, and clinics increasingly use telephone advice as an efficient, responsive, and cost-effective way to help people care for themselves or access healthcare services. In state government already telemedicine is started. Not tele-nursing, telemedicine. From PHC, they can communicate with the Jila hospital like that. Already they have started. So there are doctors in the particular room in front of computer, and in PHC there is also a room. So those cases may be referred to the higher centers. Those are discussed through conference. Nurses who provide telephone care are required to document the telephone interaction. Documentation may occur in a written form, as for example logbook or client record form, and via computer. Standardized protocols that guide the information obtained from the caller and the advice given are useful in both providing and documenting telephone nursing care. Date and time of the incoming call, including voicemail messages if the facility is having. Date and time of returning the call, name, telephone number, age of the caller if relevant, and when the anonymity is needed, you did not write those name or age of the person. Reason for the call, assessment of the client's needs, signs and symptoms described. As you know, here you can see the patient, so your assessment is according to the patient's description. What he is telling or what is his problem, upon that only you can assess the patient. And decision tree used to manage the call where it is applicable, and advice or information what you have given, any referrals made. If you refer the patient over telephone, it is not, this facility is not here, you please go there and there. So that is also you have to record. An agreement on next step for the client and the required follow-up. Telenursing is subject to the same principles of client confidentiality as all other types of nursing. So the time is most important. You should record the